Thank you, Madam President. New York State, because of Medicaid, is facing unprecedented budget gaps in the next 2 years, for this budget year and for next year. And there needs to be unprecedented addressing of the problem that Medicaid has. A program that has afforded so many quality health care has to be at a time when we have less money. Intelligently pruned, intelligently managed, change to a system that is a health system instead of something that is simply a bill-paying system. And that's all we have right now. We have offered some amendments that will increase the savings from that system, and we will offer in part of those amendments things that will address problems that are now in the main bill that I think are counterproductive, that are unwise, and will actually drive up the costs of Medicaid to the taxpayers of this state. As part of our amendments, we want to close the eligibility loopholes for certain services. We want to cap personal care services. We want to reinstate some of the expansions of eligibility that were done just last year. Not talking about things done in the past decade, prior administrations, prior majorities, just done last year, something we had a hand in. We'd also want to do that in regard to postponing the expansion of Family Health Plus enrollment to well beyond what any benefit is offered to anyone in any other state. We want to remove the readmission provision that's in the main bill. We want to evaluate the optional services and see what the priorities are of what's the most essential at a time of need. We want to establish the long-term care financing demo program, because the long-term care program in this state is a hodgepodge of different programs put together. No rhyme or reason in meshing them together, no rhyme and reason in meshing the care for the patient, no vision as to where we're going, all at a time when next January the number of baby boomers turning 65 in this nation will be about 10,000 a month. We want to establish a county nursing home demo program to convert county nursing homes into long-term care settings. We want to deal with the assisted living reimbursement rate. We want to deal with right-sizing the nursing homes. We want to up the reimbursement for buy-ins to Family Health Plus. And we want to take the penalties that are levied on individuals for Medicaid fraud and increase those. This is a very extensive and, I think, comprehensive agenda. Unlike the bill before us, which deals in a piecemeal way with so many of the budget problems, so many of the Medicaid programs, you don't know the full range of options when you're dealing with the health care budget in this fashion. Senator Krueger talked about 40% of the total budget being addressed tonight between the appropriation bill and the Article 7 bill. It's absolutely unprecedented that we have played touch football with this budget. We've abandoned the conference committees. That's our immediate history in 2007. And every week we seem to have a new procedure. You'll get a scorecard. You'll get some type of conference committees in the future. Meanwhile, we're locking people in without knowing the options. This bill does not make the healthcare system go forward. It doesn't give any opportunities for us to shape what's happening. And there's one provision in particular that I think is particularly unwise. There is a penalty given for readmissions of a patient to a hospital. Now, some people may say the federal government's doing that. Well, they are, for 3 conditions: heart attack, heart failure, and pneumonia. The bill before us would do it for all conditions. And it would say that the hospitals really have to change their mission. Right now, their mission to the patient ends when the patient is discharged. If we now say 15 and 30 days out that they have to keep track of those patients, and they'll be responsible for not getting paid if there's a readmission of those patients to the hospitals, then they're going to have to add staff They're going to have to add computers. They're going to have to add databases. They have to track. They have to make arrangements with everybody in their area, arrangements that do not exist because they don't know if somebody who has been in their hospital is within a month in another hospital. So that doesn't exist whatsoever. All of this, by the terms of the bill, is supposed to be implemented by July 2010. It's ridiculous. And what's more ridiculous is not you who want to vote for this because you feel the guns to your head. It is the Division of Budget and the governor who are saying, we want to make these policies with these enormous changes as to what's going to happen in a hospital, who's going to have to pay for that. We want to do that as part of the budget process. That's wrong. It's not good health, it's not good planning, it's not good budgeting, and we should not be doing it. We have also, pending right now, what's known as Kendra's Law, how we treat the mentally ill and whether we can go through a procedure to make sure that they have drugs, the psychotropic drugs that help the mentally ill. Well, the bill says, you know, you don't have to deal with the behavioral health readmissions, but we don't know when that is going to take place. Suppose it only occurs after they're discharged. We don't know the full scope of it. Many of the times the readmissions, as we know, this is a difficult and fragile population. They may be readmitted for something else. This bill leaves all of that undefined, unsketched out. The last part is, why do we start to find the hospitals when we may not have people who pay attention to their discharge requirements and instructions? This whole process is wrong. We need to change the Medicaid system. We need to make sure that it becomes a healthcare system. This bill doesn't do it. You're purporting to address the entire healthcare bill in this emergency extender. It doesn't have to be done this way. If you had had the conference committees, you could have had this discussion in public. You could have had it argued in public. If you don't agree with this amendment, you could have said it there. That's what democracy is all about, to have a public process, and you're not doing it. And it makes me mad because we have an opportunity to deliver better health for the people in New York. I would offer this amendment. I would suggest that everybody should support it.